Hello everyone! Here's the final concept on the integral components of client care. It's about communication. For the learning outcomes, at the end of discussion, the students will be able to discuss the components of communication process. Describe factors influencing the communication process. Describe some of the techniques on communication and be able to identify the barriers to communication. Communication, as defined, is any means of exchanging information or feelings between two or more individuals. It is intended to obtain a response. Its purposes include to influence others, to gain information, especially when the nurse will conduct assessment and provide nursing interventions. So, nurses who communicate effectively are better able to collect assessment data. Okay, so that's very important. Provide nursing interventions, evaluate outcomes because you're going to communicate with your clients, find out, ask them, okay, on how they are doing, on their improvements, promote health, and this is about health education, prevent legal problems. Again, you have to check, you have to probe, and be able to check if there's any problem. That's still with the use of communication. Okay, this is the communication process. This is actually the illustration, which we will discuss each element later. Face-to-face communication involves, right, the sender, okay, and you also have the message, and then the receiver. That's all. Okay, that's the very basic. But then, something happens in between the sender and in between the message to the receiver. So there's decoding, all right? And there are also some factors that could affect the communication process. There could be the noise, okay? And given this sender, message, receiver, okay, as how you are going to have the communication. Of course, we remember a while ago that the intention of communication is also to gain response, and that is through feedback. Because once the message was sent by the sender, then the receiver will now give feedback. Again, the message will go back to the sender, and the same thing again will happen. Okay? So, let's find out about the communication process. Sender, okay? So, here we have the source as the encoder, okay? So, the source encoder is the person or group who wishes to communicate a message to another individual. In doing the encoding, okay, the sender also can provide signs or symbols to transmit as means of communication. For example, the nurse would tell the client to wait for his medication. The tone of voice can reinforce it. Okay, message, all right, can also the message is the message itself. It is actually what is said or actually written, okay? And sometimes, of course, there are also nonverbal messages. So, an example would be nodding, sense of touch, signs, okay? Like, for example, the nurse would ask, would you like to be given a bed bath? And then the client will not say anything, but will just respond through nods. Okay? So then, the message conveyed was what? That the client agreed to be bathed, okay, in bed. So, next we have the receiver. So, we have the decoder. Okay, the receiver is the one listening, okay, to the message. So, okay, the message could either also be observed, attend. So, check out if, again, if it's non-verbal, then it can be observed. Okay, so the individual here is the decoder who must perceive what the sender is intending to convey in his message. Okay, so if there's a message of like this, a sign, what does it mean? Alright? So, again, the response here is the feedback. So, with the feedback, it can either be verbal, something said, or just shown or conveyed, which is non-verbal. Let's discuss more of that one. In the modes of communication, you have verbal, right? So you use spoken or written words. Non-verbal are gestures. They are facial expression, touch, and other forms. So if, for example, you ask a client if a client is in pain and the client will just give you a facial grimace. Okay, so what do you think is the answer? Is the client really in pain? Yes. Okay. So what if you ask the client, where is painful? Okay, the client didn't say anything but will just point at the body part which is painful. So nonverbal is actually majority of communication. Another one is use of technology. Most of the time, it's through email, where it is more complete, okay? Social media as well, through group chat, okay, chat box, and other electronic means. So, for verbal communication, let's check some of the elements here that you can find. You have the pace and intonation. This is the manner of speech, rate of rhythm. The tone will modify the feeling and impact of a message. So, for example, if you ask the client, how is she doing? And the client says, I'm fine. Okay, with verbal expression of, the eyes, the rolling up of eyes, and there's actually some formality. So you can say that the client is not fine. Another one is simplicity. Simplicity is the use of commonly understood words. So don't use technical terms whenever you talk to the client. So just use simple terms, layman's term we call it. Okay? How about the clarity and brevity? Making sure that the message is simple and direct. So do not go around the bush. Right away, tell the client how she can or he can participate or what's expected of him. Okay? Next is the timing and relevance. So this needs to be, again, appropriate. Your message should ensure, that it is appropriate to the situation, to the condition of the client. For example, a client who fears the upcoming surgery, okay, because of cancer. So, the nurse would like to actually explain what the procedures are to be taken before surgery, after surgery. So, there are many things to explain. But still, there is fear on the client's side. So, what is then the importance of timing? So maybe you can encourage the client to talk more about how she feels. And then after doing that, then answer the question or any clarifications. And if it's still okay, then you can go on with your intended message to the client. For example, about the preparation for the surgery. So that is timing and relevance. Next is adaptability. So the nurse needs to alter spoken message in accordance with behavioral cues. So for example, you have greeted the client enthusiastically, good morning. Okay, you say, good morning, ma'am. And for some reason, the client was serious and ignored you. So maybe there's something wrong. So you can change your tone of voice and ask if the client has some concerns. Okay? And the next is credibility. So this one is the means of worthiness or worthiness of belief, trustworthiness, reliability of the nurse to communicate. So make sure that what you tell the client is true. Okay? So If this is not present, then there's no means that the client will trust you and will listen to you. Next is humor. Okay, so the use of humor can be positive and a powerful tool in the nurse-client relationship. Okay, so but you just be careful when you're giving out some humors. Okay, you check the client's perception. You know, you can, whenever you get along with the client, you will easily find out the type of the client's personality. So very important that you consider the client's perception. Now, how about the nonverbal, okay? Nonverbal communication involves personal appearance, posture and gait, facial expression, gestures. Okay, so personal appearance. So clothing and adornments can be sources of information about your client. So, for example, you've seen your client with buttons of her blouse, okay, uneven. So maybe you can ask the client if she was in a hurry, okay, or have other matters that bothers her, okay. So next is you also have the posture and gait. The way people walk, okay, and carry themselves are often indicators of self-concept or self-esteem. So, also you can check here their mood and their health. For example, slouch posture, okay, and the shuffle gait. Again, if you have seen your client to be that way, then maybe it's an indication that the client feels low, or there's physical discomfort, there is sadness or loneliness, okay. Next, you have the facial expression. In facial expression, you can see the feelings of your client, okay. You can see if they're surprised, they're also angry, what else, they are in pain, so, or they are disappointed. So facial expression is very important. Okay? And if the expression sometimes it's not clear. It is different of what they said. For example, they said it's okay, but with the expression that they conveyed, it appears that it's not okay. In that manner, you must clarify, okay? You must clarify really what is the client's message, okay? Next, you have the gestures. So, in giving out gestures or in looking at gestures, you have also to consider cultural differences. Here is a sample gesture of, not wanting to take the medicine. There are cultural differences in terms of gestures, like for example nodding. If you are talking to other individuals, okay, with different nationality, for example Japanese, okay, nodding is a sign of respect. It's not a sign of agreeing, okay. What else? So in some also nationalities, we have handshake. They allow handshake. Others don't like to. It's not that they have anything against you, but it's not customary among them to have that. Okay, so sense of touch or touching is different. It's only among those that they are close with. We also have here values and perceptions, okay. So for example, the nurse draws the curtain around a woman crying, okay. So there is a personal view of an event. The woman or the client might think that the nurse would just like to leave her alone, or that maybe the curtains were drawn closed so that she cannot disturb other patients in the room. But contrary to the nurse's perception, okay, it is just to provide her privacy. So in terms of values and perception, it is important that you also tell your client or the patient the reason why you're doing such. So like, ma'am, I'm going to close the curtains to provide you privacy. Would that be okay? Alright, so that way you will be able now to clarify, or the client will not feel bad about such gesture of yours. Next is personal space. So personal space is the distance that people prefer to interact with others. Okay, we call this actually proxemics. You have to study the distance that people allow between themselves, objects or other people. So, for example, if you are with your intimate significant others, your personal space is just 1 to 2 feet. You can talk to them without any disturbance, okay, between 1 to 2 feet, or just, or very close. No distance. That's very intimate, meaning you're close. Personal, okay, if the distance is 1.5 to 4 feet. Okay? Social, you don't know them well, so you have 4 to 12 feet. Publicly, okay, that's far, okay, public. So me to the public, so that's 12 to 15 feet. Okay, so it's, again, when you say public, it requires loud voice. We have territoriality, okay, as mentioned about proxemics, so there's space, all right, so things that individual considers as belonging to self. So again, do not interfere with the individual space. You can determine that if, for example, you got close to the client during interview, you easily have the personal space, okay, then the client will move back. If that's the case, that's the sign that you must observe for the space. Okay, give the client more space. Next, you have the roles and relationship. So, between sender and receiver, okay, of the message, okay, this will affect the communication process. So, the roles and relationship. If you are talking to your boss, all right, to your professors, of course, you have to come up with some roles that you have to project. The same way when actually I talk to you as your professor. But if you're talking to your loved ones, then that's another thing as well. Then it comes along now with the relationship. So you're more comfortable. You use jargon languages if you're talking to your friends as well. Okay, next is environment. Most effective communication happens in a comfortable environment. So also you must make sure that there is privacy whenever you conduct interview with the client. You assure privacy as well. Congruence is when the verbal and nonverbal aspects of the message match. If, for example, you ask the client if he wants to eat and the answer is yes, so there's congruence. The verbal yes and the nodding yes. Okay. How about interpersonal attitude? So this can be felt, okay, whenever you talk to your client. Your care, your warmth, your respect. So, for example, in doing or in speaking to elderly, you are actually speaking in a low, slow voice, okay? Similar to baby talk, but you don't baby talk. Actually, you don't baby talk to babies, but you talk slowly, okay, and you wait for the response. And then you also show respect. You listen to what they tell you or they share. And there must be acceptance, okay? Perceptions may vary, point of views may vary, but the form of acceptance, again, can be conveyed through respect. You don't argue. Boundaries. These limits crucial, okay, to nurse-client relationship. So, some boundaries must be, again, observed, like that of, gift giving by the client, or the nurse to the client. And there's also unprofessional use of social networking where you take pictures with your client and then you share it in your Facebook account and in public setting. So that's a no-no. Okay? Next, let's check out the therapeutic communication. So therapeutic communication promotes understanding. It establishes constructive relationship between the client and the nurse and vice versa. Attentive listening is important. Listening actively, mindfully as well. You listen for key themes in communication. What does she really or he really means, okay, as your client, and then visibly tuning in. It's the manner of being present to another, having good eye contact, okay, being felt, okay, with your presence. Here are sample therapeutic communication techniques, okay? More of these communication techniques can be found in Cogir Fundamentals of Nursing. Alright, so using silence, this is accepting pauses or silence that may extend for several seconds or minutes without any interjecting verbal response. You just sit quietly. You wait attentively until the client is able to put thoughts and feelings into words. Being specific and tentative. Making statements that are specific rather than general and tentative, rather than absolute. Okay, example, please rate your pain on a scale of 0 to 10. That's specific. Okay, and you're going to explain where 0 means you don't have any pain, 1 is minimal, 2, and so on and so forth. General is, are you in pain? Yes or no? Answerable with that. Tentative, you seemed unconcerned about your diabetes. So that is, again, that's tentative. Alright? So be specific and tentative if and when only you want to explore more of the client's condition, having this tentativeness. You use open-ended questions. So questions being asked are broad questions that lead the client to explain, elaborate, clarify thoughts or feelings. So you can say to the client, I'd like to hear more about that. Tell me more. How have you been feeling lately? Okay, using touch. Alright, so appropriate form of touch, again, is used to be able to reinforce caring feelings. So, however, be conscious of or be aware of the client's cultural practices, okay? Because some don't want to be touched. And then putting an arm over the client's shoulder, placing hand over the client's hand is a simple and therapeutic way to communicate. Seeking clarification, making the client's broad overall meaning of the message more understandable. You can say to the client, I'm not sure I understand that. Or say, I'm sorry that it wasn't very clear. Let me try to explain it in another way. Okay, that's how you seek clarification. Another is to summarize and plan. So here you're going to start talking about the main points, okay? That's when you plan. When you summarize, you put okay, all the information together, all right? And then can also ask the client for any clarification. Then proceed to the planning, which is being stated in actually like this one. For the nurse, it says, during the past half hour, we have talked about diabetes, okay, its definition, its types, what else, the signs and symptoms. For the planning, tomorrow afternoon, we may explore this further. So that's summarizing and planning. Okay, so we're done with some of the therapeutic communication techniques. Now, let's identify some of the barriers to communication. Remember that there's always a need to recognize any barriers to communication whenever they happen to prevent what? Miscommunication, to prevent being misunderstood. So, the major barriers to communication are failure to listen, improperly decoding the client's intended message. Sometimes you are already preemptive of what the client will say and wrong about it, okay? So another one is placing the nurse's needs above the client's needs. So please, again, your focus of care is the client. Let's have stereotyping. Stereotyping is offering generalized and oversimplified beliefs about group of people. Like for example, the nurse would say, men don't cry. Or you would conclude, 2-year-old children are brats. Okay, so that's stereotyping. Next, we have agreeing and disagreeing. So this is similar to judgmental responses. It implies that the client may be right or wrong. It deters the client from thinking through their position and may cause a client to become defensive. So, client could say, I don't think that Dr. A is a good doctor. And the nurse here would say, Dr. A is the head of surgery and excellent doctor. So, that's a barrier. Probing. So here, you're asking for information out of curiosity rather than to assist the client. You're asking why, okay? Places the client in a defensive position like, why were you speeding before you go to that place? And that, again, makes you commit accident. And why did you not? So these are probing questions that are barriers. You don't ask why, because the client will feel that they are being judged. So if I don't ask why, then how can I find out more? Okay, maybe that's your question. You can ask, what happened? What do you think? But not why. All right? Next, we have unwanted assurance. So, you're using cliches or comforting statements to reassure the clients. Here, you're blocking the feelings and fears of the client. Like the nurse would say, you'll feel better soon. Don't worry. So, do not reassure, okay? So, each phase next is about the nursing process, all right? Now you're going to conduct assessment, then to until evaluation. So we are now going to clarify functions and roles, any expectations of the client, the nurse, and primary care provider. In terms of communication, where there is impaired communication, you also need to assess for the language deficits. For example, you're using English language and the client is not responding. Maybe you need to ask, what's the primary language of the client? How about sensory? Is the client able to hear well? Okay, any other cognitive impairments? So you have to assess that. How about structural deficits? How about paralysis? Okay, so this will limit the client to convey good or very well meaningful gestures. All right. So next is, what is the style of communication? Is it verbal? Whether the pattern is slow, rapid, quiet, okay? What's the vocabulary of the individual or your client? Is there any presence of hostility, aggression, assertiveness, okay? Anxiety? Is there difficulties in speaking, like slurring of speech, stuttering, or there's inability to speak or refusal to speak? So this will be also correlated to the condition of the client. Like for example, those who just had stroke, then you cannot expect that they will fastly communicate with you or talk to you. There can be slurring of speech. Next, take note also of the nonverbal cues, okay, that the client will show you. For the diagnosis, these are sample diagnosis, okay? Okay, the first part of the diagnosis, the problem. So maybe there's an impaired verbal communication. So this is not used when it's caused by a psychiatric illness because you will be biased. So you are just going to be specific, like is there anxiety, is there depression, okay, powerlessness as well, situational low self-esteem, social isolation, impaired social interaction. So these are some of the problems. For its implementation, you are to manipulate the environment in a way that you are going to provide privacy. You're going to ask the client if he's comfortable, okay, as you interview or ask the client, and then you provide support. All right, you just, of course, practice therapeutic communication techniques, and that will also employ measure to enhance communication. And then you educate the client and the support persons. If, for example, there's a difficulty in conveying messages or in providing proper communication, then this can be part of your health education. All right. So, for the evaluation, you look forward to a desired outcome, which is the client communicating effectively through active listening, observance of nonverbal cues, okay, and the use of therapeutic communication skills. So, the nurse's communication is actually being practiced with the use of a process recording, where there is the information or verbatim about or with the client, okay, you're going to quote the client's verbatim conversation, and then you're going to analyze the content and meaning of interaction. This is where the theme would come now. So, this one will increase your awareness and insight about what really is the condition or feeling or what the message is being mentioned here or being tried to convey by the patient. And then here, you also have to identify the strengths and the need for future skills development. Alright? So, thank you. Maraming salamat po sa pakikinig. Okay? So, thank you for listening and joining me with the different integral components of client care. I know it's quite a long. So, congratulations for being able to finish this discussion. Alright? And please study about our quizzes, okay? Or shall we say quiz for this discussion. Okay, thank you and have a nice day, everyone.